Today I met a gentleman who was a physician, a surgeon, who had dementia. He was only about 10 years older than me. He went to the same medical school I went to. We talked about the same professors we both had. We both had the same mentor in terms of surgery, Dr. Block. And it's really hard to see somebody who's just 10 years older than you with dementia. That is a horrible disease which currently there are 7 million people in America getting. So you can imagine this brilliant surgeon now doesn't know where he is. He is being fed on a feeding tube. He is confined to his bed. He still has distant memories, but he thinks he's 2,000 miles from here, and he can give me his home address from 30 years ago, but not now. What can you do to prevent dementia? There are a few things. Number one, the best diet to prevent dementia is called the MIND diet, which stands for a Mediterranean interventional for neurodegenerative disease, or the Mediterranean diet. People who eat more fruits and vegetables, whole grains and legumes, not refined grains, have a decreased incidence of dementia by 20 to 50%. That's the best thing you can do to prevent dementia. Once it's there, we don't have many drugs or interventions that will help it. And in spite of some people calling it diabetes 3, it's not. While people with diabetes have a higher incidence of dementia, remember dementia is a broad category of diseases of the brain which decrease cognitive function. Cognitive function should not decline that much in people as you age. My father was 98 years old when he died, sharp as a tack up until the time he died. That should be everybody's, what we would hope for. But there is a disease for which we don't have a lot of good information about. Now, here's things that will not help you. Lion's mane will not help you. NAD will not help you. A lot of these longevity researchers, all of those supplements and things will not help you prevent dementia. And if you have dementia, they will not help you get better from it. And remember this, dementia is not a disease of progressively going down. It's steps. So first you forget where your keys are, then you forget what your name is, and it goes on and on from there. The bottom line is dementia gets better and worse. So people may spontaneously get a little bit better. They may be worse for a while, and they may get better. And you may see this in yourself, not dementia, but anytime you're stressed, your memory doesn't work as well. Anytime you are depressed, your memory doesn't work as well. There are some medications which give you brain fog. Some medications like Benadryl is probably the classic one. And they give you brain fog to where you feel like you can't coordinate as well. Or alcohol gives you a depression of your brain function. All of those things are not dementia, but they can exacerbate it. And people with dementia will have good days when they appear to be perfectly fine and can seemingly carry on a normal conversation, but their brain function isn't there. So dementia is a disease that can come and go, and because people can see little improvements in it, that's the trick of people selling you supplements that don't work. Because they'll sell you something and say, oh, it seemed to improve Aunt Betty for a little while, but it doesn't hold in long-term results. So don't waste your money on supplements or vitamins. Do eat better, more fruits, more vegetables, more legumes, Mediterranean diet. And we need to put and continue to put more funding into the research to prevent this disease.